Good afternoon. I'm Michelle Larkin, Assistant Vice President at the Robert Wood Johnson Foundation. Thank you for joining today's live County Health Rankings webcast. We're looking forward to sharing information with you today about the 5th edition of the County Health Rankings. We'll also be giving you a glimpse of some communities across the country working to build a culture of health. We invite you to engage in today's conversation and share your thoughts, views, and questions via Twitter. Use hashtag HealthRankings. That's HealthRankings, all one word. And we hope you will visit and learn more about the health of your county and how you compare with other counties in your state and how you can take action to create a culture of health in your community. For more than 40 years, the Robert Wood Johnson Foundation has worked to improve health and health care for all Americans. Our vision is a nation where getting healthy, staying healthy, and making sure our children grow up healthy are top priorities. Building a culture of health is the central aim of everything that we do at the Foundation. It means recognizing that while Americans' economic, geographic, or social circumstances may differ, we all aspire to lead the best, healthiest lives we can. Tremendous opportunity exists at the local level to improve health where we live, learn, work, and play. And the County Health Rankings are a starting point for change. Communities across the nation are using the rankings to identify where they are doing well and where they need to do better for their health. The rankings are inspiring people to take action to improve their health and the health of their families and their communities. As I mentioned, this is the 5th release of the County Health Rankings. It's been a tremendous partnership between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Joining me today is my friend and colleague, Dr. Patrick Remington, Associate Dean for the University of Wisconsin School of Medicine and Public Health. Pat led the development of the County Health Rankings when the University of Wisconsin began ranking each county in Wisconsin over 10 years ago. Good afternoon, Pat.
Good afternoon, Michelle.
Also with us today is Dr. Julie Willems Van Dyke, the Deputy Director for the County Health Rankings and Roadmaps program. She's been a driving force in helping communities around the country use the rankings and build a culture of health. It's great to have you here with us, Julie.
Great to be with you too, Michelle.
When the Robert Wood Johnson Foundation and the University of Wisconsin came together to launch the rankings, we realized that their potential in influencing how we as a nation think about health, and they really have become an important resource in building a healthier nation, county by county, community by community. Before we dive into our discussion, let's take a closer look at exactly how the County Health Rankings work.
What makes a community healthy or unhealthy? You might think it's what happens in a hospital or a doctor's office. But that's only a small piece of the puzzle. The County Health Rankings are grounded in science. Many factors matter. Clinical care, whether we have access to good doctors and quality health care when we get sick. Our health behaviors, like whether we smoke or have the opportunity to eat healthy meals. But also social and economic factors, like education and income that heavily influence whether we have the opportunities to be healthy. And the physical environment, like whether we have clean air and water, as well as safe and healthy homes, and the means to get to places where we need to be, like jobs, childcare, and stores. The rankings put all this together to provide a new way to think about health in our communities. And with this knowledge, each of us can help build a culture of health, county by county.
So Julie, there's a lot for people to consider when thinking about health. How can people use the County Health Rankings to find out about the health of their county?
Well, Michelle, the first thing people can do is go to countyhealthrankings.org and look up their county. First and foremost, you learn how your county ranks overall within your state. The information in the County Health Rankings is pulled from a variety of national sources, such as the National Center for Health Statistics, the U.S. Census, the FBI, and we even go to NASA for our measure of air quality. You can see how your county ranks on health outcomes, which help you understand how healthy your county is today. And then you can see how your county fares on health factors, which influence how healthy your county will be in the future. There are 4 categories of health factors: health behaviors such as smoking and healthy eating, access to and quality of clinical care, social and economic factors like education and employment, and then the physical environment, including housing and transportation. We then give different weights to each of these categories because some influence health more than others do. You'll see that the social and economic factors actually contribute the most to how long and how well we live. The health factors are where we can target action, from making it safer to bike and walk in your town, to making sure all kids get a great education, because we know that people who exercise more and who have more education live longer and healthier lives. The good news is that we can all do something to improve each of these factors. On the countyhealthrankings.org website, you can also look at trends for individual measures over time. These trends are helpful because they allow us to see where there is progress and also where there is room for improvement. I think you'll all find that the rankings really are an easy-to-use, one-stop shop for a picture of how healthy our lives can be.
While the rankings focus greatly on county-to-county comparisons, within a state, are there any national trends? Pat, what are we seeing for this year's trends?
One of the things we continue to see is significant gaps that exist between the least healthy and the healthiest counties. Sometimes the range within states is tremendous, even for counties located right next to each other. The rankings show us that people living in the least healthy counties have twice the premature death rates than those living in the healthiest counties. This means that where you live matters to your health, and it's also a strong predictor in how long you live. There are also twice as many children living in poverty in the least healthy county as in the healthiest counties. The percent of children in poverty was decreasing in the 1990s, but between 2007 and 2012, it rose from 18% to 23%. That's the wrong direction, and it is very disturbing. We know that the level of children living in poverty is not only important today, but it's linked to how long and healthy and productive children's lives will be in the future. And it also emphasizes the importance of getting kids out of poverty and making sure that they can get a good education. These are key to building that culture of health. The rankings help us to pay more attention to those early years because of the lifelong benefits. These can be significant. And speaking of young people, overall teen birth rates have decreased by about 25% since 2007, which is good news. But there are still twice as many teen births in the least healthy counties compared to the healthiest counties. So again, the gaps between the healthiest counties and the least healthy counties in each state are stark. For instance, in my home state of Wisconsin, the teen birth rate is almost 17 times higher in the least healthy county compared to the healthiest county. And there's other good news. We know that tobacco use is the leading cause of preventable death in the country, affecting not only those who smoke, but also those who spend a lot of time around smokers. But we're pleased to see that smoking rates dropped from 21% in 2005 to 18% in 2012. Another encouraging trend is violent crime. We've seen a decrease in rates by almost 50% over the past 2 decades.
Those are significant findings, Pat. A lot of important trends to continue to monitor and watch over time. Julie, there's a lot that impacts our health, and the rankings include nearly 30 factors.
That's right, Michelle. And every year we make adjustments to make the rankings more informative and helpful to communities, and to reflect our ever-expanding understanding of the many things that impact health. This year is no different, so we've added several new measures. For instance, housing. The connection between housing and health is significant. Our homes protect us from extreme weather. They are the physical structures where we build our lives, raise our families, and spend a lot of time together. This year's rankings show us that almost 1 in 5 households are either overcrowded pose a severe cost burden, or lack adequate facilities to cook, clean, or bathe. We've also added transportation measures. Too often, neighborhoods lack sidewalks or safe crossings, or communities have limited public transit options. What that means is that we spend a lot more time in our cars, and when we're driving in a car, we're not exercising. And we're often by ourselves, driving alone, so there's no social interaction, particularly if you're driving longer than 30 minutes each way to work or to school. Our new transit measure shows us that more than 3/4 of workers drive to work alone, which contributes to poor health. Mental health is another important part of overall health, and our new mental health measure looks at the access to mental health providers in a given county. The availability of these providers in the healthiest counties is 30% higher than in the least healthy counties.
Pat, are there other new measures we should know about?
There are, Michelle. In addition to the ones Julie mentioned, we've also added a food environment index. The food environment index looks at the challenges people face when they don't have enough money to adequately feed their families, or where the only thing they can afford is unhealthy food because it's cheap. Perhaps because there isn't a supermarket or farmer's market with affordable fresh fruits and vegetables nearby, their food choices are severely limited. Another new measure within community safety is injury deaths due to unintentional and intentional injuries. An important factor to explore, particularly because injuries are the leading cause of death among young people in the country. The rankings emphasize those things that can be changed. Many injuries are predictable and preventable, and there are things communities can do to shore up their prevention efforts. Our What Works for Health section on the website, countyhealthrankings.org, has a wealth of information to help you find and implement programs and policies that have strong evidence of effectiveness. Another measure we've added is access to exercise opportunities. We measure whether there's a park or recreational facility, such as a gym, community center, or a pool, that's relatively close by, within 5 minutes of where people live. So there are quite a few new measures, which I encourage all to check out. Again, our website is countyhealthrankings.org. See how your county is doing and explore solutions that have been put in place in other communities to address these same challenges.
Pat, it's great that you mentioned that communities can do things to address these challenges. So many communities say, we have this information, we know we did well or we know we didn't, so what? What do we do with it? While the rankings provide us with a way to broaden the conversation about health, the roadmaps as part of the larger County Health Rankings and Roadmaps program help us take action. They help to answer the what do we do with the rankings question. So whether you're an educator, a policymaker, a business leader, or a mom or dad raising your family, there's a section on countyhealthrankings.org that will show you what you can do with the rankings to start a conversation in your community, and more important, how you make changes to make your community healthier. The rankings and roadmaps describe how to bring community members from all walks of life to the table, to create a shared vision and create a framework for building a healthier community, how to focus on the most important priorities, and what steps can be taken collectively to improve health. Let me give you a few examples. We work closely with national organizations that are active locally, including the United Way, the National Association of Counties, and the National Business Coalition on Health. They are using the County Health Rankings and Roadmaps to engage their local members to make change happen. Julie, can you tell us about some of the places around the country using the rankings and roadmaps to rally members of the community?
Absolutely, Michelle. This is one of the things that I'm most excited about with the County Health Rankings. Communities are harnessing the valuable insights that they gather from the rankings, and they are tapping into the roadmaps resources and creating solutions that work. For example, the United Way of Greater Toledo saw the rankings as a call to action and has used many of the roadmaps tools to expand their collaborations, to focus on healthy eating and active living, and how to work together as a whole community to improve their high school graduation rates. As this example shows, the rankings are only as meaningful as the action they inspire, the people they bring to the table, and the lives they improve. And it's just one example of the groundswell of activity and bright spots throughout the country. For example, there are 3 community events coming up. One in Rockingham County, North Carolina, happening as we speak, another in Frankfort, Kentucky, and a third in Amherst, New York.
That's great, Julie. Let's take a closer look at these communities and see what they're doing.
The health rankings show us that where you live, work, play, and learn have a huge impact on how long you live and how well you live.
The county health rankings were a real wake-up call for us.
They show us our strengths and our opportunities for improvement.
Rockingham County.
Western New York.
Grant County.
The health rankings help spur the conversation.
What does smoking do to you?
The rankings help us set priorities and tell us what needs to change in our communities.
We realized we had to go deeper and look for root cause in our communities.
Partnerships to improve health are absolutely essential.
We began working with communities to design solutions.
We all have to do this together.
It's really exciting to see the work underway in these communities. Communities that have varying levels of resources, challenges, and priorities, but all are working on improving health through the county health rankings. Spotlighting the places that are coming together to create a culture of health is really important, and it's an important thing for us to continue to do. It's important to hold up shining examples that exist across the country in large, small, urban, suburban, and rural areas so communities can learn from each other. For example, in Louisiana and Philadelphia, the United Way is working with government and educators to ensure all kids start kindergarten on a level playing field by improving early childhood education. In Baltimore, Baltimoreans united in leadership development and its coalition partners have been successful in securing funding to replace and renovate dilapidated and neglected schools to ensure young people succeed and excel. In Columbia, Missouri, PedNet Coalition is using health impact assessments to show the link between new public transit options, employment, and health. No single person or group can tackle these problems alone. These efforts include leaders from business, government, nonprofits, and faith-based institutions all joining together. They recognize that we all have a role to play in improving our health and the health of our families and communities.
You're right, Michelle. We do learn a lot from those communities. The Robert Wood Johnson Foundation Culture of Health Prize winners are outstanding examples of places that are building a culture of health for all their residents. They've excelled in leadership and collaboration, and they're working across the many factors that influence health, intentionally addressing the issues that disproportionately affect vulnerable populations. They're also building a foundation for sustainable, long-term solutions and using resources creatively.
Let's take a look at our 2013 prize-winning communities.
Winning the Roadmaps to Health Prize is a validation of the work that we have done as a community.
The way we've done our work here really is a roadmap.
It's also an opportunity for us to build on the work that we're doing.
People from outside our community are saying that the work we're doing matters.
We have something to offer, even beyond ourselves, to teach people where we've come from.
It inspires our community to be confident in themselves.
I am extremely optimistic about the future of our health.
Our students harvest the food from seed to table.
We've worked on improving the school breakfast.
When kids are healthier, their learning sparks.
They really feel excited about physical activity.
We're trying to focus on factors like literacy that people don't generally associate with health.
We've made a concerted effort to address the issues of health disparities.
The focus of our work is helping people who have committed crimes to re-enter society,
to contribute to their families and to their own health.
So our focus is absolutely on closing those gaps between haves and have-nots.
The key is fostering the kind of multi-sectoral partnerships we've been able to put together here.
We've been able to bring together a coalition that doesn't look at just one problem.
One of our major goals in addressing health disparities is improving access to health care in some of our poorest neighborhoods.
We can achieve many things together that none of us could achieve alone.
That's something that gives me lots and lots of hope.
I never tire of hearing about the prize communities, and I'm so looking forward to announcing the 6 2014 prize winners this June at the Aspen Ideas Festival. We've had such a great discussion today. Now we want you to join in and tell us your thoughts on building a culture of health and on the county health rankings. So now let's answer some of the questions that are coming in. Pat, one of the questions that came in from Susan Sloan on Twitter asks about how changes in the health factors affect the overall health rankings.
Well, Susan, that's a good question. As you know, there are two parts of the rankings, the health outcomes ranking and the health factors. The health outcomes ranking hasn't changed in the 5 years since we've been ranking communities. That looks at death rates and 3 measures of quality of life and a measure of low birth weight. We've kept those the same because many people start their conversation by thinking about how the health of their community is today. But when we get to the health factors, some of those measures have changed for a couple of reasons. One is more data has become available. We've now got access to data on housing. At the beginning, we didn't have data on water quality, and now we do. So as new data becomes available, we bring it into the rankings. The other issue is our sense of how to measure the health, those health factors has evolved. We recognize, importantly, the effect of the built environment. So we're changing some of the measures that we use. Now, overall, you can go on the website and look at each of the factors from 2010 to 2014 to see how they've affected your rankings and the health factors. But it's important to note when you go up to the top of the snapshot for your county, to know that measure on health outcomes has been the same. So any change you see in the measures or any change you see in the rankings and the outcomes is because of changes really in the data and not in the measures.
Thanks, Pat. So one of the other questions that came in is not just how the rankings have changed, but Julie, how have the conversations around health evolved in communities as you've been out and about over the last 5 years?
I would say, Michelle, it's been an incredible change in the conversation. So what has really happened is people now are starting to talk about these many factors that influence health. When we first started the rankings 5 years ago and talked about social and economic factors, many people would say, why is that in a health report? I thought this was about medical care or maybe about smoking and healthy eating and active living, but what is this stuff about employment and education? I think more and more we're seeing people understand that those important factors about education and income and community safety and feeling connected as a community are key determinants of health. The other thing that has done then has really increased the sensitivity and awareness that it really does take all of us to build a culture of health. We can't do this and just lay this report at the door of our public health department or our hospital. We need all of those leaders coming together. You've heard us mention United Way several times here today. United Ways have been critical partners because they have always been conveners across the community. We've seen Chamber of Commerce leaders. We've seen mayors stand up and take ownership of this report and really stimulate great work coming together. And then finally, we've seen people really turn to not only thinking about how they can put new programs in place, but how can they change policies in their community to do things that are going to be long-lasting. For example, you were talking about the places that are working on early childhood and how we make sure every child in a community, not just the children who come from families with good incomes can afford early childhood education, but families that come from all income levels in our community have access to good quality early childhood to send them on a great educational journey for their life.
Great. Thanks, Julie. And Pat, we also have another question from Twitter from Salud Today that asks about the national trends in exercise, housing, and the other data points. Can you talk a little bit about what we're seeing this year?
Sure. Some of the measures have a small icon. It shows a trend graph, and you'll be able to see for your county trends in that measure. For example, rates of premature mortality or premature death. So sometimes people ask us, how do I know I'm getting better? Should my rank be going up or down? We don't focus so much on the changing rank because that not only is affected by the health factors in your community, but by how other communities are doing. So we consider this really a call to action. One of the things you can do in responding is to drill down and look at the data that you have more closely. There are many more sources of data available locally than we could possibly have for the county health rankings. We take data that's available nationally, readily available, and is available for all 3,000 counties. But communities will find, as they look into these issues like housing, like physical activity, that they're much more helpful information locally, and so you turn then to those and really dig deeper into your own community.
That's great, thanks. So one of the specific questions that I'm not sure we know the answer to because it's a new measure for us this year is from Jen Carson on Twitter. She asks, she's curious about how to increase access to mental health providers and what does a community do to address that?
Well, I think that is a challenging issue, and one of the things that caused us to add this measure is that we know many more people in our nation are going to have access to health insurance through the implementation of the Affordable Care Act. And so more people are going to have insurance to pay for mental health providers. And I think as communities see that there is a source of payment for these services, it will be more likely that mental health providers may relocate or in communities that have fewer mental health resources. The other thing about mental health that I think is really important for us to think about is access to mental health providers is one part of the solution, but it's also what are we doing in our community to build healthy environments where people feel mentally healthy? How are we connecting neighbors with each other and helping communities build that strong social fabric? What are we doing to support families so that they are good sources of good mental health and emotional support for communities? What are we doing in our schools to make sure children feel safe and that there isn't bullying going around? And all of those different kinds of strategies are really important ways to get at this important issue of mental health, in addition to being sure that we have enough mental health providers when people are experiencing mental health distress.
That's great, Julie. Thanks for sharing that. It sounds like there's a lot going on across the country that we can learn from.
Michelle.
I have another question from Trevor Carlson on Twitter. He asks if has there been a decrease in healthcare costs for counties that have worked their way up in the rankings over the last 5 years?
Well, Trevor, that's a great question. Healthcare costs are included on the website, but we don't rank on the healthcare costs. So when you look at the website, you'll see measures that are in the health factors or health outcomes. You'll also see a tab that says other measures. And you can actually go in there and look at one of the ways we measure healthcare costs. It's based on the average cost of Medicare beneficiaries. It's not the perfect measure. It's not certainly the only measure that's available, but it is available because Medicare covers people in every county and every state. It is interesting to look at that measure. Sometimes those costs can be high because people are sick in that community. In my home state of Wisconsin, we see some of the highest costs in areas with the least healthy populations. But as you know, sometimes those costs can be high because there are high charges, that the cost of the service provided is high. So this really should provoke you to look within your community, ask the questions of the provider community. What drives higher costs? Is it less healthy populations who are getting appropriate care, or could it be that the population is relatively healthy and they're just charging a lot and people are paying a lot for health care? So again, we don't answer the question, we really start the conversation, provide the data that you can now ask, why is it that my county ranks #1 in the average cost per Medicare beneficiary, and what can we do to not only bring those costs down, but to continue to improve the quality of care?
Thanks. So Pat, you just talked about being able to go online at countyhealthrankings.org and dive into the data, not just on the up to 30 measures that are included in the rankings, but also on the local data that's available that we don't have for every county in the U.S., which is why it's not included. But what else, Julie? What other resources are available on the website that people can use to help start the conversation? Yes, but how do they take that and move to action?
Well, there are numerous resources, Michelle. So we have the Roadmaps to Health Action Center, and we have laid out an action cycle that will look familiar to many of you if you've ever been part of a strategic planning cycle or a community health improvement planning process. Simple steps from starting from assessing those needs and resources, digging deeper, as Pat has mentioned here, to setting priorities, to choosing effective policies and programs, and then, of course, implementing them and evaluating how well you're doing that. And of course, we want people to be doing that with partners across the community working together and communicating what you're doing to people so that they can get involved. So we have tools and resources for each one of those steps along the way, including that really great resource that was mentioned earlier, What Works for Health, which is basically what we've done is look into research and literature that really illustrates what's working best to affect each of these measures that are in the county health rankings so that communities can put their dollars and their energy towards the most effective programs. The other thing on the website we have is a place that says need help. So if you look at this and you're kind of stuck and say, I don't know quite where to start, just contact us. You can email us, you can call us, and we have community coaches available at the Roadmaps to Health Action Center that are there to consult with you about what your next step might be in your community. And then lastly, as mentioned earlier, we have lots of stories from other communities across the nation because we know communities learn best from others that are very much like them. And so go to the website and see what another community, perhaps in another state that's similar to you, is doing, or even one of your neighbors in your own state.
So are those resources just for the folks who are in the middle or at the bottom of the rankings? That's a question that Anna Rosenbaum asks. Her county is second best in her state, and she wants to know if the rankings can still be used as a call to action for them.
Well, absolutely, Anna. You won't stay in the top of the rankings unless you keep your eye on the ball and keep working on areas that you can improve. And as Pat mentioned, one of the things on the rankings is not only the trend information you can look at, but also comparing your well-ranked county to those top U.S. performers. So maybe you're doing really well in your state, but there might be others in the country that are doing better than you that you can strive to be in that top U.S. performer category. So I think it's a really great opportunity, whether you rank in the highest level, the middle level, or the lowest levels within your state, to use these resources to continue to improve health.
So Pat, I have another question for you about the data. This is from Karen Armitage, and she asks, Can you help counties and communities out there target their efforts to use their limited resources by refining certain rankings to zip code or geo maps? Is that in the plans?
Well, Karen, that's a great question. The county health rankings is, I consider it to be like a view from 30,000 feet. Another metaphor is it's a Polaroid snapshot. It's not a high resolution 15 megapixel image. It really is a quick flyover of the community. But as you point out, those data are really available in many communities. When you go to your local registrar, you'll find not just rates of premature death, but you'll actually find death certificates that have listed the underlying causes and contributing causes. You'll have local survey data. And you'll also have very detailed census data that look census block by block to find those areas that are leading to the overall challenges you see in an entire community. So again, you can't look at the entire nation, you can't look at a state, and really we realize you can't look at an entire county. It's a good way to start the conversation, but the solutions are often going to be delivered neighborhood by neighborhood, block by block, and those data are available. We do provide links for every state to the state data resources, and we encourage people to start a conversation about successes. Where have you found good sources of data, and how has that really then driven action following looking at the data?
So Pat, you just mentioned the census data. Was that used with the housing measure? We've got somebody on Twitter who's asked that question. What was the data source for the housing measure?
Well, the housing measure is a measure that includes a number of factors, not just characteristics of the housing, which does come from census, that is plumbing and kitchen facilities, but also affordability. So within the census, you can look at the affordability of a home. If people are spending more than half of their income on housing costs, that turns out to be a severe housing problem. So we encourage people not to just look at that summary measure, but actually dig down deeper, because obviously solutions will be different if you have housing that is a problem because of lack of plumbing. That's different than lack of affordability. In fact, I was surprised in some of the communities that are fairly affluent that there are housing problems. My bet is when you dig deeper that those will be issues of affordability and less related to the actual structure of the home.
And one last question from Felicia Anthony on the data. Have the rankings had an effect on the diabetes epidemic that we have in this nation?
Well, unfortunately, we have not seen a change nationally in rates of diabetes. We are starting to see some exciting changes in prevalence of obesity in the youngest population nationally, and also in selected communities. This is a great example where our measure, which is a measure of adult obesity, is going to take a while to change. But communities can go into their schools, into even preschools, collect that information and begin to see whether the programs they're putting on the ground are having an effect. But overall, this is a challenging issue. It's going to take many years to put the programs and policies in place that will see improvements in diet and physical activity related outcomes.
Thanks, Pat. Well, we're getting a great response on Twitter from all of you. Keep your questions coming. We have time for a few more. And so, Julie, back to you. Jenny Day Burgett on Twitter asks about violence. And can you talk a little bit about how violence impacts the health rankings? You know, for us at the foundation, we know that if we want to have a culture of health, we actually need to make sure that we have a society that has very little violence in it and make sure that people are safe and that we have safe and resilient communities for our children. Can you talk a little bit about the violence measure and also what you're hearing from communities about how they're addressing the safety issues?
Sure. So violence is one of the measures in the community safety component of the social and economic factors and the health factors ranking. And you're absolutely right, Michelle, that violence is a critical issue as it impacts communities. I mean, first of all, there's the whole issue of the victims of violence and the trauma and the potential even loss of life that can happen for them. But there's also the stress of living in a violent community. If you're afraid to walk out your front door and to exercise or to go to the store or to walk to school, that takes a great toll on you day in and day out. And so there's not one simple solution to improving violence in a community. It really goes to many of the other health factors that we've talked about today, but it's also part about how do we build that sense of community? How do we build safe schools? How do we teach new behaviors to our youngest children about how we interact with each other? And then how do we help people who may be the victims of violence recover from the trauma of that? And how do we help people who may be the perpetrators of violence learn new skills and new ways of addressing the stressful situations in their lives to cope with that? We've seen a variety of initiatives in this regard. For example, our prize-winning community in New Orleans has really linked their Women, Infant, and Children program with a domestic violence screening program to really help women and families who are in that situation of domestic violence get help earlier. And that's been a very effective strategy. In New Orleans, they're also working on neighborhood violence and what they can do to reduce those issues. And so really promising work moving forward.
That's great and so important for our communities across the nation. Pat, Margaret T. asks how the rankings can be unpacked to discover and eliminate disparities. We get this question a lot. What can we do using the rankings to address disparities?
Well, that's a great question, Margaret. When we first developed the rankings in Wisconsin, we were struck by the disparities that existed between places. Communities that are right next to each other can have great differences in health outcomes and health factors. But we know that when you think about communities, you can think about communities not by geography, but by common ethnicity or racial issues or economic issues. So we encourage people to look at the information within their state by these factors, but also to drill down within your community. You'll find information available that can tease out some of these differences. But I will point out that in our state, the differences that we see, for example, in teenage pregnancy may be 2 times higher in African American teenage girls compared to whites, but the differences are 10 or 15 times by where people live. So the effect of the community is often more important than the effect of social and economic factors. Obviously, they're all related. So we don't want people to just limit the discussion to counties. We want really the discussion to go in to tease out all these factors and obviously to bring up the issues of health disparities within communities.
Thanks, Pat. So we're going to do our last question. And Julie, I'm going to kick it to you because I know you've been doing a tour since we started this in 2010 to communities across the country. How have policymakers responded to the rankings? Are they reluctant to really look at them when they're not in the top, or are we seeing something different here?
Well, we are starting to see policymakers really embrace this work. And when I hear that question, I always have to go back to one of the early policymaker adopters of the county health rankings, and that was Mayor Joe Reardon in Wyandotte County, Kansas, which is the Kansas City part of the Kansas City metro area. And one of the things that Mayor Reardon said to me after he did take this report, embraced being the lowest ranking county in Kansas, and said, we're going to do something about this as a community, is he told me, you know, staff tell a policymaker run away from this data. You don't want to be the elected official showing bad data in your community. But he felt in order for their community to be all that they wanted to be, he needed to stand behind it. And he also told me something else that was really important that I think is important to share with our policymakers and remember when we approach them. He said to me, you know, Julie, I'm a lawyer, and they never taught me about the social determinants of health when I went to law school. And so this report has really helped me see that even though we're the home of the KU Medical Center, there are so many other things in our community that we need to do to move health forward. And so I'm so happy to report that it's not just Mayor Reardon who's taken that charge, but Mayor Chip Johnson in Hernando, Mississippi, commissioners in Wake County, North Carolina, commissioners in Sonoma County, California. We're seeing elected officials across the nation embrace this work and really think about how they can lead efforts across sectors to make their communities healthier places to live, learn, work, and play.
Thanks, Julie. I think that's a great example for us to end our question session on. Thanks to all of you for the great questions that you've been submitting online. As you can imagine, we received more thought-provoking questions than we were able to get to today. So please know we will continue the conversation next Friday, April 4th at noon Eastern Time on our RWJF First Friday Google Hangout series. And please visit thecountyhealthrankings.org and rwjf.org to learn how you can build a culture of health. Pat and Julie, I want to thank you so much for being here with us today. You shared great examples and stories from across the country.
Thank you, and I did want to shout out to Bridget Catlin, the leader of the County Health Rankings and Roadmaps, and the team back in Madison. None of this would have been possible without the strong support of the people actually doing the work, putting the rankings together.
It's a great addition.
Absolutely. Thank you, Michelle.
And on behalf of the Robert Wood Johnson Foundation and all of us here and the folks back in Wisconsin and New Jersey, thank you for joining us today.